record and ask everyone if you wouldn't mind muting while others are speaking. And then when we get to the Q&A session, then we'll just open it up and have a full conversation. But we are interested in hearing questions, comments, and discussion towards the end of the hour. So please stick around. Also, if you want to be alerted to future events, if you could please include your name, affiliation, and your email address in the chat, we'll make sure to capture those and add you to the Healthy Champaign County mailing list. So with that, I'd like to welcome everyone to this State of the Plate speaker series. My name is Traci Barkley. I'm the director of Sola Gratia Farm. We are a nonprofit urban vegetable farm dedicated to feeding our community and expanding access to fresh, healthy food, especially for those with limited food dollars. This is the second State of the Plate speaker series we started last year. It's really a build up to the food summit. We've now had two Champaign County food summits, and the third one is coming up soon. We actually moved it from April dates to February so that we could include more growers in the area. By April, we're so busy in the greenhouses and prepping the fields that I think we missed a significant component the last couple of years. So we've moved it up to February. It's February 26th this year. It's an all-day event. So please save the date now, and we'll make sure to send an email your way for the formal invitation to register for that. So the whole point of the summit is to bring folks working in Champaign County on food security issues into the same room to talk about what's working, what's not working, identify any gaps, look for additional partnership opportunities, and just do a better job of meeting our community's needs. So each year we learn a lot from who's in the room and the conversations that happen about how to facilitate it better, who we should be inviting that wasn't in the room before, and just, how to keep that network growing stronger and stronger. And then also it's an important opportunity for both service providers and for funders to see what the needs are, like what the themes are that are coming up. And this really started after COVID, where we learned a lot about what works and what doesn't work. So thank you to everyone that's been a part of it to date. And if you haven't, please mark your calendars and make sure to join us on February 26th. Okay, so the State of the Plate speaker series is really to lay the groundwork for the next food summit. And it is an opportunity for us to share community perspectives on food security work. So thank you for joining us today. We're going to hear today from Karen Sims of the CU Trauma and Resilience Initiative, from Brittany Tuten from Cunningham Township, from Akua from New American Welcome Center, and Beverly Baker from United Way. So we're going to be talking about wraparound services, what the service delivery model is, why it's important, how it works, and how that looks in Champaign County and serving a couple different populations in need. Before we get started, are there any questions or any housekeeping issues that need to be addressed? Okay, great. Well, with that, thank you very much for joining us and for participating in the discussion to follow. Let's go ahead and get started. So I'm going to ask everyone, I personally find it really awkward to have someone else read a bio if I'm presenting. So I really would like to just turn the floor over to each of our guests and ask you to introduce yourselves, your name, your organization or agency you're working with, the work that you do, and what your impact is in the community, just so we know who's in the room and a little bit about you. So Karen, if you wouldn't mind starting.
Hi, I'm Karen Sims with the Trauma and Resiliency Initiative. And I'm happy to be here. Don't know what else you want me to add.
Well, can you share a little bit about what your organization does and maybe what region you're serving, what population you're serving? And
Yes,
and if you have a success you want to share, something you're really proud of, that would be great.
great. So we try primarily serve Champaign County. And so that's what we do. We provide education, training, and support to individuals impacted by adverse community experiences and trauma. And we especially have a specific focus on working to provide services and supports to individuals impacted by community adversities like gun violence and celebrations and successes. I'm looking at Tom. So we do things both individually and group based, and uh, probably our biggest celebration or successes are just the momentum that we get when we started our Come and Clean group yesterday. So that felt like it's a group for individuals who have a loved one or a family member who's been impacted by addictions. And although the group started off small, just the conversations that have happened on the community level, sort of peer by peer, have just been really phenomenal. So those to me are always wins when we're building community capacity to have conversations around taking care of its own.
Wonderful. Thanks, Karen. All right, Brittany, do you mind going next?
I would not mind. My name is Brittany Tuten. I'm a licensed social worker working with the Cunningham Township Supervisor's Office. Um, if you haven't heard of us, we're a hyper-local unit of government in the city of Urbana, and we serve that population with general cash assistance, rental assistance, different various housing programs. We have a shelter for homeless families and shelter programs for medically fragile homeless individuals. Um, Food assistance, and I don't know. There's things out there. You name it, we probably do it, or we'll find a way to do it. Currently, I serve as a case manager for housing navigation for homeless families with income who are on our priority list for placement in shelter. However, since our shelters are full, we don't really have a place for them immediately, so I'm helping them apply to housing in the meantime, and then taking referrals that come from different partners and things like that.
Great. Thank you. All right. Akua, can you please go next? Introduce yourself.
Sure. Good afternoon, everyone. My name is Akua Forkuo-Sekyere. Thank you for the invitation to be here today. I work at the New American Welcome Center, and that is an organization or a program rather out of the University YMCA. And we provide services to immigrants in Champaign County. Our services include legal services and assistance, referral linkage, direct assistance. We have an immigrant family services program, and we do community building type of work as well. So we organize Welcoming Week with a lot of different partners, which you may know of. And we also work with the city of Champaign in facilitating the Welcoming Plan. So that's a little bit about the New American Welcome Center. We also refer to ourselves as NOC.
All right. Last but not least, Beverly, can you tell us about yourself and a little bit about United Way and 211?
Sure. Hi, everyone. I'm Beverly Baker, and I'm with United Way of Champaign County. Again, you're probably familiar with at least the logo and the branding connected to United Way. We are part of a national and international organization, but we are here local, and our primary focus is Champaign County. So we have that brand recognition. We have a lot of resources and supports that come from being part of a larger organization, some professional development, best practices, things like that, as well as the opportunity to learn and share with other United Ways across the United States and across the world, actually. But we are all about Champaign County. So our work is two-sided. We raise funds. We provide that vehicle for people to give and for businesses and organizations to give. And then we help those funds get back into the community, either the way the donor wants it to be invested or through opportunities where we have grant opportunities and grant applications available focused on key issues that are of a priority concern for our community. So right now, our key grant areas are community essentials, which is that safety net of services, food, shelter, healthcare, technology and access to resources. Those are those, we got to have these things. And if you're in crisis, these are the things that you need. Early grade level success, which is focusing on birth through third grade child development and academic achievement, and then child well-being, trauma, and mental health. Our child abuse and neglect rates are significant in our community to be a community of our size. So we've put some special focus on providing both prevention and treatment resources back into our community. And so we grant either through a donor's choice or through a grant application process over $3 million back into the community every year. So that is a bit about us. You did mention 211. 211 is a piece of work. It's a service that we provide in partnership with the Mental Health and Developmental Disabilities Boards. We provide the funding to make sure that 211 services are available here for Champaign County. There is a goal for 211 to be statewide, and I actually happen to serve on that 211 board of directors as well to help make that happen. And 211 is a 24/7, 365 information and referral line that anyone can contact to get connected to human service needs and what resources are available in the community. So we'll talk a little bit more about that as the time together goes on. Thanks, Traci.
Thank you. All right, thanks everyone. That's a great start to understanding kind of the different groups that are working in our communities to serve specific populations in need. I will say in Healthy Champaign County, as we've talked about, just what conversations to help facilitate and how to be prepared for a good, inclusive, impactful food summit. We started talking about wraparound services, and even with the steering group, within the steering group, we had a pretty rich discussion of what are wraparound services, what do they include, who's providing them in our community, what's not wraparound, or are there like variations on the theme? And so it really sparked for us. If we're having this conversation, this is really probably, there's probably many folks that could use a better understanding of what it is, isn't, and how it's happening in our community. So I asked Karen to please just lay some groundwork, help us better understand what this delivery service model is. And yeah, do you mind taking it away, Karen? Thanks.
So I'm going to keep this as brief as I can because there's a long conversation about what wraparound is and isn't, and depending on where you're located. So I will anchor this part of the conversation primarily on Illinois because I think it's helpful. So wraparound at its core is a service, a way of providing services that grew out of a couple of things. One was when Indian children or Native American children or Indigenous children were being overly represented and displaced in residential schools, in out of community placements. There was a major class action lawsuit, and it primarily started in Alaska. And so Indigenous families or Native American families said, we have a practice model that is ours, where we bring our village together and we have elders and secret keepers who can come up with solutions and strategies that are our own to help children who have complicated mental health needs, right? And so it really comes from a community-based, culturally responsive lens that has not just professionals come together, but people in the community who have lived experience, who have ongoing relationships with people who are in need, using cultural practices to help people heal, be resilient, and recover. That's where it started. However, like all good things, it became incredibly professional. And so in Illinois, Carl and Kathy Dennis, who were the founders of an organization in Chicago called Kaleidoscope, that actually Champaign County has worked with for a really, really long time. When Illinois was having problems with an overrepresentation of children of color being placed in long-term placements out of the community, and it was disproportionately impacting children of color and low wealth children. Carl and Kathy Dennis came up with a practice model based on that original Alaska model, taking all of those policies and practices using, again, wraparound has some core values. It is always collaborative. It is always community-based. It is always strength-based. It is always outcome-based. It is always unconditional, and it always is financially responsible. And it always elevates the voices of the people most impacted by the problem. So if we're talking family and children, they're always at the fore of the plan. And so using this model, this collaborative decision-making model, and it means, right, like, and when I say collaborative, I really do mean everybody at the same time having conversations, one conversation about the needs and strengths and about what the plan is, and so that people don't navigate through multiple different systems of support. They come to one table. This is actually a pretty revolutionary approach, right? And the outcomes, particularly for the early wraparound model, were phenomenal. It kept children at home, helped families together, and that model has sort of morphed and been adopted. And then people talk about this whole concept called high fidelity wraparound, because it is sort of been, endorsed throughout the federal government in different states and different cities. Those kind of core values have stayed the same. And many people now, when they talk about wraparound, really just mean holistic or comprehensive or cross systems, which is not what wraparound is supposed to be. So people will write, got a wraparound plan. And what they mean is we're just thinking of all the domains of needs, but they're not talking together. It's not one conversation. It's not happening simultaneously. And high fidelity wraparound looks at a couple of things like how much do people who are most impacted by the problem, how represented is their voice at the table? So we were talking about like AI. So I can track like how many times providers talk in a meeting versus how many times the individual talks and tells you what they want and need. I can track voice and choice. Does everybody get the same thing? Or do we really individualize a plan based on the needs of that person? Are we really collaborating, or are we just sitting around the same table? So collaboration from a wraparound model means we make decisions together with the family or with the individual. And I want to have one caveat, but we actually play together. So like if I have a resource, I'm looking at Cunningham because we've done a little bit of this, but if I have a resource, you do your part, I do my part, we bring in other people, and then we pool all of our resources to make a whole. And sometimes we stretch the rules, and where we can get community resources, we want those coming in because there should be some things on the plan that don't cost anything, that no one has to pay for, that there are resources always in individuals and families. So high fidelity wraparound is like looking at all of this. And then the last thing that I want to say before I wraparound started off as a children's mental health effort, but it is a model that has been proven to be effective if we're talking about homelessness, if we're talking food insecurity. So if we're talking seniors, anytime that there are complex needs. So it's not meant to deal with little problems. So there's no need to invest time, talent, energy around collaborative decision-making for little things. It's when people are involved in 2 or 3 systems or have big problems or there's multiple needs, then you do wraparound, and it has been used in all of those cases. And so if we want to work well and more sustainable, bringing people to tables. So some communities have like standing, and we used to have the land here for children. Some communities have standing meetings where if there are complicated needs, people come together on a way strategically to pool resources. Where our land went wrong was families were not at the table and youth weren't at the table. And sometimes it became really provider driven. other communities have right, a coordinated council that really supports people, that has all of those representative bodies, particularly around big needs. So like I can imagine in our community, when we think about families, particularly families who are experiencing homelessness, imagine if every Friday families knew that they could come with their plans and really have people all look at them together and think about where are all the resources, and that we thought outside the box, because the idea is that we don't want to just do the same thing, because everybody's way for like housing security or financial security is going to be very individualized. And sometimes we build capacity, and sometimes you've got like family members and friends or an uncle. I'm going to stop talking, but one of my favorite stories, when we had the Access Initiative, we had a family who was having a lot of struggles with rentals, paying rent on time. And their landlord was a part of their wraparound plan. And so we were sitting at the table, and their child was also having some complications with the juvenile justice system. So the landlord listens, and to like realizing that the young person at the table really had some career aspirations around mechanics and auto repair. And the landlord also had an auto repair shop. So the landlord let the young man spend some time and energy volunteering and working at the auto repair shop until it became a job. And that job helped address some of the financial issues. The landlord also, and not every landlord would do this, but really was aware of like all of the things the family was really doing to kind of get their lives better. And for a while, reduced the amount of rent while the family was sort of getting on their feet, because he saw what the bigger plan was. And so he made a year agreement that if they finished school, the young man finished his program, and mom actually ended up creating her own business that was really successful, that is still successful today. But that's the kind of thing that a real wraparound plan does. It doesn't look like people just put people in programs. It looks like the community really decides to make people's lives better in meaningful ways. So that's the spiel.
And that's Tracy, if I can interject in there, I put it in the chat. I was so glad that Karen alluded to that. The term wraparound has broadened over time. It really has gotten loose, and it's used very loosely anymore. But when you go back to, again, the fidelity to what it was originally intended to be and how it's implemented, again, a lot of people use it. They use it in grant applications. And just because you do a lot of things, or because you make a lot of referrals to other partners, that is not wraparound. And so I just wanted to point that out. And this was a great opportunity. And Karen, that was a great explanation of the brief explanation of the history of wraparound and what it truly means. Because like I said, it's a term that gets thrown around and has different connotations to it. So thank you for sharing that.
Thank you, Karen, so much. I was thinking, I really wanted to ask you to provide an example, which you then went ahead and did. And as I was listening to you describe the model and how it works and how it's supposed to work, I was thinking it sounds so challenging. Like it's a very hard way to go about it, but the outcomes would be so much greater. And one of the things I was thinking is that just having so many, the community in the room and so many people in the room, there's such an opportunity for listening to each other and learning from each other. And then your example just illustrated that beautifully. So thank you very much. I would like to go next to either Brittany or Akua and just ask if you could talk a little bit about what wraparound means for each of your agencies or organizations. And then also if you could provide an example to just kind of illustrate, what that might look like for your work and your service. How about Akua? Would you mind going next? Thanks.
Sure thing. I was looking at Brittany. But yes, and as I'm processing, Karen, thank you for explanation as well, and your examples. It definitely has me thinking about the services that we have at the New American Welcome Center and things that, we may think we're doing well in, and also things that we could be doing better when it comes to wraparound services as well. The note about things becoming more professionalized, which I think is something, which is a trap that a lot of our organizations may fall in because of the expectations around grants and funders, getting away. So anyways, I'm reflecting and processing. But to get to your question, Tracy, about what wraparound services means, for us, the immediate thing that comes to mind is that we are supporting more and more new arrivals who have come to our community for a better way of life, if you will, and how we are defining new arrivals. Excuse me, I have my dogs in the background. Is an individual is coming who has come to states in the past 2 years, maybe seeking asylum, maybe undocumented, but in short, is experiencing a lot of needs around, experiencing a lot of basic needs, a lot of complex needs. And in the past few years, this has made us look at our services in a different type of way. So one, before, our funding didn't necessarily allow for a lot of the flexibility that supporting individuals who don't necessarily have jobs need. So being able to help with rent, cash assistance, things of that sort. In the past year or so, our funding has expanded to include some of those needs, which has been helpful. But also, as we work with partners around housing, food, transportation, it can be really hard to get support for those families because there may be limits to those situations, like we talked about, or to those resources, like we talked before a little bit about housing. Brittany mentioned that shelters are full, and that's the case just across our community. And so, what that has looked like for us is trying to still figure things out. And it has required a lot of problem solving. It has required a lot of problem brainstorming, a lot of problem realizing, even if we may not necessarily have a solution, but it has elevated gaps that we have in our community to the point of, thinking, okay, we really need to find creative ways to address this or these concerns so that families have access to these needs. And if there are issues and concerns with resources that require these big solutions, what can we do in the interim? And that has been a very hard question for us to answer and grapple with. And so, for example, working with housing, we have a grant that helps support folks with rent assistance, but it's like a Band-Aid solution can help folks with rent for oh so long. But if we can only allow 1 or 2 payments in a year, and if there's no housing for folks to be able to move into, like, what does that look like? So that I might be rambling a little bit as I'm processing, but that is an example of how we're approaching services that require the collaboration of other partners. And so some of these conversations have come up in spaces like the Community Alliance, which is a meeting, a monthly meeting where various partners of social organizations come together to talk through immigrant issues and concerns. It has also come up in our welcoming plan meetings as well. And so I think there could be a lot more room for growth when it comes to wraparound services around basic needs for new arrivals in our community.
You're on mute, Tracy, but I
Oh,
can just go.
sorry.
It's all
Okay.
good.
Thank you very much, Akua. Brittany's next. Sorry about that.
No, just like Akua though, I'm definitely processing. the wraparound model that Karen just laid out. I think that is such a goal that is so attainable, especially in this community with how many resources there are. I think every single week I learn about a new organization with resources that I need for my clients. I think that is such an attainable goal that we can strive for. But our office right now, to reach the goal of wraparound services, the first thing that we do is make sure that we are very client focused and client centered. Um, the first thing I do is when I interact with, let's say, a new client comes to me and we're completing a centralized intake for the homeless, was the first step in getting somebody on the coordinated entry list. With RPC and everything and connected with different wait lists for shelters. We do a brief needs assessment that tells me exactly what, if they have utility arrears, if they need transportation assistance, if they need food, if they need winter clothing, if they need anything like that. It's just a brief little needs assessment that we do. And right now we have a winter coat drive. We can connect them with winter clothes. We have a food assistance program. We can get connected with food that way. Um, we can connect them with LIHEAP, get them their utilities taken care of. We try and kind of go through that needs assessment and address each need as it comes up. We want to make sure we have as much information at the front as we can, but I know a lot of clients won't be very forthcoming with that right off the bat. You have to build that relationship in order to get that way. So, and like Karen said, you want to make it really individualized for each person because not everybody is going to come to you with no eviction history and $3,000 of income, ready to be housed or any other way. No one's a perfect client or anything like that. So we want to make sure we can address any combination of vulnerabilities being thrown at us, and try and find a way to navigate that storm together with the client. And if that means advocating on their behalf to other partners and getting other partners to come meet with us at the table to think of a plan, that is what we do.
That's great. When Karen was first describing wraparound services, a few, there were just a number of attributes that, Karen, you shared define what a wraparound service is, being outcome based and collaborative, and having lived experience and really, all sectors of the community at the table. And there were two things that stood out to me as being just seemingly challenging. And I wondered if anyone on the panel could speak to this, the fact that there's unconditional support and financial responsibility just seem like real. How are you achieving that? What are some of the needs, and maybe what are some of the other challenges or just barriers that your organizations have to being able to provide wraparound services?
So I'll chime in. And so I went to the fiscal responsibility, fiscally responsive, and your question was around outcome-based and fiscal responsiveness, right? Were those the pieces?
Well, I mean, I think there's a lot to it, but the two that stood out to me were just the unconditional and
Okay, so
the financial responsive.
Okay, so I want to offer this just because I think about it a lot. There are families in our community, individuals and families in our community that are incredibly vulnerable. And they are incredibly vulnerable because they have been failed by many helping systems. And if we think about this from a cost perspective, right? So if you, I don't know if everybody knows, but like if you go to the ER more than 3 times, Medicaid actually bills you for that. Like they think if you have to keep coming to emergency crises, that something is happening about your hospital and you should pay for it. I don't think we do that in human services. We have families who have been in crises for a long time, and the investment that we could spend on really making sure that they are well might cost a little bit in the front end, but the cost that we would save in our community for them, their well-being, education, child welfare, choose a system, we're going to save money overall if we take care of families who have the most needs, and many of those families have complex trauma. And when we like fire you because you've missed 3 appointments or put you on the back of the line, or you do things that we say make you service ineligible, it's not like your needs went away. They actually just get deeper. So, like, I remind people for every time a woman and a child is homeless, anytime a woman and a child is homeless, she and her children probably experience 4 more traumas. Does it make sense to put together a team to really provide unconditional care for that mother and child? Or to wait until the children are in child welfare and the mom has also had a psychotic break and has had multiple sexual assaults and domestic violence, and all of those are costs. You're still paying for it. It's just when do you choose to pay for it and how much do you choose to pay for it? That's kind of one of the ways that makes it fiscally responsible. The other way that it makes it fiscally responsive is, I think, and this is no shame, but people, when we don't collaborate, people just pay for things. And sometimes we don't problem solve. And so when we have a wraparound meeting, and it can be frustrating for people who are not used to this, I know it's definitely frustrating for my team. A couple people will tell you. We're not paying for anything until we figured out where the other options are. And so we're not going to RPC for financial support until the family has, and again, this might not sound nice, but like, where are resources? Because if you haven't learned problem solving, when the problem happens again, all you do is have to go to a resource. But if you've learned problem solving, you're thinking, maybe I plan ahead, or maybe I borrow from all of these people. Because sometimes, right, people don't know how to think through, like how to develop a plan and then go to a resource. I was just talking to people on my team this morning. A family had some food insecurity, and I reminded my team, is this like a crisis where today, because I wasn't working, there was food insecurity? Or is it that every month I don't have enough food? Well, if every month I don't have enough food, that's another need. So then I need to help you understand how to work with food banks, how to supplement your cooking, how to build a budget, how to think about what you're eating, like those are different, right? So if every time you have food insecurity, we feel like we need to get you food, that's one approach. If it's how do I help you understand what your food budget is and how to supplement and augment and use the farm and use all of the farmers market, like how to use it well, how to stretch your dollar. Right? I might have to help you learn how to cook differently, how to help, right? Like that's long term versus short term. That's how we get fiscal responsibility.
Okay, and then I'm going to turn this to Akua, because all of that is challenging. I mean, all of those different systems, all those different barriers, the timeline. But then, you have people in a completely new home, in a new country, a new community. Can you speak, Akua, to just, some of the unique challenges that immigrants face, building on what Karen just shared?
Sure, sure. This is something that we speak a lot in our organization because our mission basically says that we support immigrants in their journeys to thrive and flourish. And that part about thriving and flourishing, what exactly does that mean, especially now as we support a number of families who have um, a lot of complex basic needs, ba basic, or excuse me, have a lot of needs around basic needs that are pretty complex. Um, Coming into, a new country, a new environment, there are also language access issues too. It can be very hard when we're trying to think of someone being able to quote unquote thrive and flourish. There's a lot of different steps that are required to get there. And, you know, this is really good because I'm processing, because Karen, you just said a lot of good stuff, so I'm processing as I'm talking. But for the communities that we, or for the families that we serve at NOC, as we are helping them along their journey, they're coming to us, especially for our new arrival families, in a place of crisis because of the experience that they have had to deal with for however long in their journey. Also trying to navigate a whole new system, and a whole new culture. Some of us have arrived to our community from Chicago because things didn't necessarily work out in Chicago for various reasons, and then coming into our community as well. And so a lot of times we focus on those immediate needs to be able to support them. So if, okay, where can we find, let's say, a hotel or a motel? Can we find housing? Here is assistance around getting a bus pass. Here is some assistance in getting food. But a lot of times it's really hard to put them on that path because they don't necessarily have employment opportunities or options. They don't necessarily have access to supports that would encourage a longer term plan. And that can make it very hard in trying to think about someone becoming quote unquote fiscal responsible. We're just at a place where we have to provide unconditional support, in my opinion. So for example, someone being able to utilize translators and interpreters as they're figuring out, and that requires long-term support for many of our families as well. And so that's something that we've been debating or talking about. So for example, how does it make sense to give families multiple supports around rent multiple times in a year? You know, some folks think, okay, maybe we're creating a culture of dependence, whereas some folks say, you know, this is needed. So there's different perspectives and values that we are dealing with. But the reality of the situation is that we really need to support people during these vulnerable times. And if we have the means to do so, we're going to use those supports in that way. It's not perfect. You know, ideally, we would love to get to a point where we can support individuals to make, I guess, firmer and deeper roots. So last year, for example, for families that were a bit more stable, if you will, we were able to partner with U of I Extension around budgeting support, which was really well liked by most of the families that were there in those classes. And then some families, you know, also shared that this was something that they just can't think of right now. So it's in short complicated. It's very complicated. But in thinking of those with very complex needs, it can be hard to think of like those longer term goals because of the concerns around crisis.
Thank you, Akua. I just want to be mindful of the time. We're getting close to the last quarter of our time together. So I wanted to open this up to any other questions that folks on the call might have for our panel. If not, I have another question, but I'll wait.
I actually have a question.
Sure, go ahead.
And first of all, thank you for the information. It's been very, very useful. I think in a way we had been trying to provide some version of wraparound services, especially to the newcomers and the unaccompanied minors in the district. But as I hear to the information presented, I frequently feel lonely frustrated because I do know that there are a lot of services in the community, and many times it's not really easy to access the services or to connect families with those services. So I know that time is short on this call, but I just wanted to put this out there. If anybody has any suggestions, I feel like we had done a great job adding more supports. We have a food pantry in the school. We have a closet for clothes. Every time a family comes, we base the assistance that we provide on the family and on the student to make sure that we cover some of the needs that they have, immediate needs. Since last year, I started working more with homeless families too, but I feel like it keeps adding up, and I don't see a lot of change on how easy we can find supports for those families, and I'm not sure how to do that or what we're doing wrong. I also wanted to say, because of what is happening with politics, we're going to be focusing a lot probably in the next couple of months on just providing information to families. Tonight, we have our first Know Your Rights training. We're going to help families complete emergency plans, temporary custody letters, and all of that as we did 8 years ago. We have been hearing from families, and a lot of people are very, very concerned, afraid. So I hope the community is getting ready for that as a community too. But I will welcome any suggestions, any help, because I do feel like we are providing the services. I would just love to find a way to make it a little easier on those of us who are doing the direct work with, especially with immigrants. My office is now at the high school, and I'm working with families who speak Russian and Hebrew and French, and I don't speak those languages, but there is no one else doing it. So we will welcome any help. Thank you. Thank you for this. It was great.
I can speak on that a little bit. So I'm sure, as you know, Lucia, that the Cunningham Township has a partnership that's still with USD 116. So we're still accepting referrals for homeless families that need services. They would be connected. That referral goes directly to me, and I follow up with that family. And we talk about disabilities in the household, children in the household, where they've been staying, if they're with family and friends, how long they can stay there, if they're sleeping unsheltered in a car, anything like that. We'll kind of talk about safety planning and then getting them connected to doing a CIH, or centralized intake for the homeless, and getting them on different wait lists for shelters. And like we said a couple of times in this forum, I know in my dream universe, we would have shelter for everybody that needed it right away. And unfortunately, that's just it's a circumstance that everybody in our community is facing right now, especially with families and individuals, is that all of our shelters are bursting at the seams, with families and individuals seeking shelter. So that is something we're working on and looking to address. I know we're meeting monthly right now to try and figure out plan Bs on everybody's part. But I'm happy to connect about referrals for that aspect and what we can do there. Talk about, we still have rental assistance, and I know RPC still has rental assistance. City of Champaign Township still has rental assistance if there's income coming in. And then there are other options for cash assistance through our office and things like that too. But if you want to connect offline, that's totally fine as well. I'm good for that.
Can I offer just a fantasy? So Lucia, so imagine though, rather than make a referral. So this is what a wraparound around, like Akua, Lucia, Brittany meeting together along with and someone from RPC, knowing that there's already a meeting on. So there's not like a referral, like you guys have a meeting, and that maybe there are people like at that meeting, like maybe Lucia, somebody who's navigated through the process 2 years ago, is there because they kind of know some resources and they're like on the ground, so they could still talk to the family and they don't always have to go through you. And then maybe there are a couple other people, and then maybe there are language brokers, people from the university who want to volunteer or donate time or have resources, come together regularly to address the needs, not like a referral, because I will tell you, multiple referrals are traumatic to people with complex needs. And I know it seems like it's a warm handoff, but it is stressful. And there's also redundancy that happen. So just think about a fantasy where there are peers and community people and you all working together, because you guys are doing heavy lifting, and wraparound is designed to stop you from burning out, because complicated problems that you are handling on your own will kill you. And so, right, like it causes you health problems and mental health problems and social, and it is hard for clients. But imagine you coming together, really collaborating with and then you guys can also help prioritize needs, really focus on what's what. And so it doesn't get segmented. And then people don't also have to tell their stories to 13 different people. Like right now, every referral is another intake. Imagine if you were all talking and just making it easier. And I think when we look at the future of what the next 6 months can be, where there could be fewer resources and more needs, we've got to work differently. I don't mean to be mean, but like it's got to be different, because this model isn't sustainable given that resources are going to contract.
I love your fantasy. I love that you're making it reality, and I'd love to see more opportunities to make that the reality. So I guess what I want to hear with our last couple of minutes left is, can each of the service providers please share what is, and I know these are all limitations, but what are the biggest limitations? Are they trained professionals? Are they time? Is it money? Is it trust by the client? Commitment to the model? What's the biggest need to make this fantasy more of a reality for more service providers working together on this? Is it all of the above?
It's all of the above. Yeah,
Yeah.
it's all of the above. I mean, back to Karen's original point and the comment about making it make financial sense. We do have a lot of money put into programs and services and supports in this community, across the state, across the country. But if we're not using them to their fullest advantage, we're wasting money, because we have some people who are, and this is going to sound horrible and I don't mean it to, they're being overserved, right? They are in every system, they're getting all kinds of services, or they're on all kinds of waiting lists. They've got all the referrals. And then there are other people who are not connected at all, or they're only connected to one thing. So we've got to use what we have better and smarter. We've been having that conversation a lot, using the example around shelter and looking at winter, and making sure that every available bed at the different service providers is being utilized in any way that it can be. And making sure that, if there's a bed that's empty, can we get somebody in it, kind of a thinking, just using that as one example. So how do we use what we already have and use it better and smarter? That adage of work smarter, not harder.
Yep.
And so I do think at some point we need to pull back from our service delivery systems and look at what we're doing and how we're doing it, and are we using the supports that we have and the services that we have in the best possible way.
Final questions, final thoughts? Akua?
Yeah, I'm just gonna add on to what Bev just shared, but also connect this to the question that Lucia asked as well. That's been something that I have been thinking of with the existing spaces that we have to talk about immigrant concerns. And a lot of times those conversations tend to be nebulous or up there, kind of idealist, if you will. And there's, I think, a lot of opportunity to bring it down to where we're able to talk through cases, or for folks to be able to bring up things that they are working on and dealing with, and be able to use those spaces to problem solve, or see if service providers in those spaces can have or can name either resources or possible solutions in those existing spaces. Is that something that we can, I think, do better on and better with? In terms of barriers, that exists. Yes to all of the above, but also it can be very easy to get into that space of being siloed, because sometimes it's really hard to be engaged in all of the meetings that come up or keep track of all of the different things that are going on. And so, yes, I agree. If there's ways that we can utilize existing spaces better, that can help benefit people who are actually accessing those meeting spaces. I think that could be something that could be very helpful, especially in these next few months as a new presidential administration comes on board. So that's something for me to think about.
Okay, thank you so much. There's some good ideas in the chat, which I hope everyone has an opportunity to look at. I do want to remind you, I know the Food Summit is specifically talking about one resource that is needed in our community, but there's a central theme here of just connecting and doing a better job of working together to meet our neighbors' needs. So there was just a call for proposals for the Food Summit on what conversations do you want to have? What spaces do you want to have created with that day that we have together? So I would really encourage each of you to think about what you'd like to get, what was highlighted here today, what you see in your work as a need, and can we use that space we have together in February to facilitate conversations, meet each other, and come up with some solutions. So please include your email. If you're not already getting the emails from Healthy Champaign County, include your email in the chat. We'll make sure that you get the call for proposals, the invitation. And then finally, I just want to say thank you so much to Karen, Akua, Brittany, and Beverly for being part of this really important conversation. An hour goes so fast. Thank you for everyone that was part of this. I'm going to encourage us to get this video out on YouTube and out on social media and to our partners soon, because there's a very big opportunity in the next couple of weeks with the end of year giving to see that these are really good resources that could use some additional support to serve our community. So thank you very much for your time. Appreciate it. Hope everyone enjoys the snow and has a good evening ahead. So long. Thank you.
Thank you. Good night, everyone.
Thank you so much. Thank you. Thank you.
Yeah. Have a good evening, everyone.
My heart is so full and of inspiration. I really appreciate all that you brought. And Karen, especially, I think a few folks said it, like you just sparked a lot of thoughts about like what's working, what's not, how we can do it better. And I just thank you.
No, thank you. So, and looking forward to continuing partnerships. So thanks.
All right. Have a good night.
Be
Thank
well.
you so much.